Hi, our group agrees that it is not ethical to honor the patient's decision to refuse to initiate breast cancer surgery and treatment.
We're Group A, and our group agrees that it is ethical for the provider in this case to honor the patient's decision to refuse surgery and treatment for breast cancer as she expressed she wanted to seek treatment from a faith healer from her church.
So honoring the patient's decision to refuse treatment directly conflicts with the ethical principles of beneficence and non-maleficence. Healthcare providers have an obligation to act in the best interest of the patient while preventing harm, and respecting the patient's decision would violate both of those principles. So beneficence requires healthcare workers to benefit the well-being of the patients, ensuring that they receive necessary care to preserve their lives. The patient has a good prognosis with the recommended surgery and treatment. However, by declining the treatment, the patient is choosing an outcome that would most likely lead to further progression of the disease, poor quality of life, and premature death. Additionally, the patient is a mother to young children who are dependent on her for care. Accepting the patient's refusal for effective treatment threatens the patient's life and also her children's lives, creating unnecessary detriment.
The non-maleficence principle is directly violated when a healthcare provider passively allows preventable life-threatening disease to progress untreated, ultimately resulting in the harm to the patient. If the patient's cancer advances to later stages, treatment becomes less effective and they'll endure more pain and suffering that could have been avoided through early treatment and surgery. So, some background information. In situations where refusal of care leads to avoidable suffering and survival risks, it's not ethical to simply just honor the patient's wishes. Healthcare providers must take actions to prioritize life, health, and the well-being of the patient. Balancing autonomy and the principles of maleficence and non-maleficence are crucial in religiously motivated treatment. Limiting autonomy has led to significant medical advancements that benefit patients. For example, Jehovah's Witnesses allow for the development of alternative treatments and blood-saving techniques that benefited many patients by reducing risks associated with blood transfusions. These advancements align with the ethical principles of beneficence and non-maleficence. Therefore, depending on the patient's denomination, it's completely plausible that she may willingly form a compromise that aligns with her religious beliefs, but also protects her from harm associated with refusing treatment altogether.
So, if we ignore her decision to refuse treatment, that is violating the ethical principle of autonomy, which gives her the ability to make her own decision. And if the four components of decision-making capacity are present for this patient, then our argument makes sense and her decision must be honored.
Autonomy is defined as the capacity to act upon your decisions freely and independently. And under this principle, the patient has the right to make her own decisions and refuse treatment for religious reasons if she chooses to do so, like in this case. In this case, we are assuming that the patient has the capacity to exercise her autonomy. Capacity is a person's ability to process information and make an informed decision about their care in a way that aligns with their beliefs, values, and preferences, which includes the possibility of refusal of care. Even if the treatment is medically recommended, with autonomy, she has the right to decline. If the provider does not honor the patient's choice, there is a direct violation of the principle of autonomy to freely act upon her decision to seek treatment in her religious beliefs.
So the Supreme Court has recognized that the Due Process Clause in the U.S. Constitution includes the right to refuse medical care while considering public health safety and human life. Expectations to this law are applicable only in severe cases of illness, mental incapacity, or individuals that pose a direct threat to the state. Informed consent must be given, which includes assessment of patient competence and comprehension, disclosure of relevant information, and affirmatively obtaining consent, which must be done without pressure or coercion. It is important to provide alternative options for treatment for the patient and an incorporation of religion into the treatment to ensure that the patient understands that the medical care can be life-saving and individualized.
So, while it is crucial to acknowledge religion in the formation of a patient's individualized care plan, it's also crucial for the patient to understand the fatal risks of refusing treatment. In our encouragement for the patient to undergo surgery and treatment, we do not wish to strip her of autonomy, but we hope to instill the basis of complementary medicine instead of alternative medicine. So, as the name suggests, complementary medicine, such as faith healing, is gladly welcomed as a complement to traditional medicine, but it does not need to be an alternative. We suggest bringing in the patient's faith leader to offer support and guidance to find a common ground between medical treatment and her belief system. In many cases, hesitancy about treatment is resolved when patients are given permission from their faith leader and the knowledge that they will still be supported and accepted by their church. By forming this relationship, we aim to form a trust bond based on the idea that we all want what is best for her well-being. The protection of the patient's autonomy is critical, but we believe not guiding her to also seek additional treatment violates the ethical principle of beneficence, and it is not in the best interest of the patient. The ethical principle of autonomy requires true informed consent and the allowance of the patient to make informed decisions about their own life. And it is possible that the patient's decision may be based on misinformation, so it's crucial that the patient makes decisions based on both scientific medical evidence and her faith. In 2021, there was a study examined the refusal of different types of treatment of cancer, such as surgery, chemo, radiation, endocrine therapy, and their overall impact on survival. And the study found that the refusal of surgery resulted in the strongest association with mortality. And the refusal of other medical treatment also resulted in a higher mortality rate. So while of course it's her right to refuse life-saving medical treatment under the Supreme Court, it is similar in our eyes to refusing food and water. We know these things to sustain and support our lives, and we know that the absence of them will result in an almost certain death. Autonomy is a key principle, but the ethical balance shifts when a refusal of treatment risks harm not only to the patient, but also to her dependent children. In situations where refusal of care leads to avoidable suffering and threats to survival, it's not ethical to simply honor the patient's wishes, and it's our responsibility to prioritize life, health, and well-being of the patient.
Ethical principle of non-maleficence states to do no harm, and although medications, treatments, and surgeries come with risks, they can ultimately slow or stop cancer progression, increasing the likelihood of long-term survival and improving the patient's quality of life. Any medical intervention reduces the risk of cancer recurrence, as opposed to no intervention at all. Avoiding surgery will not eliminate mental distress for this patient. As the cancer progresses unchecked, the patient will inevitably experience worsening symptoms, which can contribute to further mental distress. Ultimately, by honoring her refusal of treatment, she has an increased risk of prolonged suffering in the future as her cancer progresses. Non-maleficence extends beyond the mother to her children since they are dependent on her for care and stability. By refusing treatment, she risks premature death or severe illness. This will likely cause significant emotional and psychological distress to her children. Ultimately, honoring the patient's decision would harm not only her life, but her children's as well. It's important to respect the patient's beliefs. However, the actions she takes based on those beliefs carry severe consequences, increasing the risk of death and jeopardizing her children's well-being. It's also important that as healthcare providers, we don't condone actions that lead to preventable harm. First, understanding whether the patient's faith prohibits surgery or is a personal preference can help the patient and provider have an open discussion. Faith and medicine are not mutually exclusive, therefore finding alternative counseling can help the patient accept the treatment and may allow her to maintain her faith while undergoing treatment. It's critical to do this now, as the decision may not be reversible later, or the treatment may not be as effective later if the patient realizes that the faith healer's attempts have failed at curing her breast cancer. For example, a shift in policy has allowed Jehovah's Witnesses to receive certain medical treatments without facing punishment from their church. This change reflects how religion can adapt to modern medical advancements and continues to do so. While the patient may refuse treatment now on behalf of her faith, future policy may encourage treatment options that align with her faith and science. Overall, fidelity means we can respect our patients' beliefs while prioritizing their well-being without enabling preventable harm.
So it was argued that allowing patients to refuse treatment goes against beneficence and non-maleficence because healthcare workers have that duty to act in the patient's best interest by strongly encouraging the treatment and preventing harm done by the disease state itself. However, it can be argued that coercion into treatment can contradict those same exact principles of beneficence and non-maleficence. So, as healthcare workers, there is a significant amount of value placed on physical health, but psychological health is just as important. And forcing treatment of any degree may cause significant trauma, anxiety, distress. Um, and while the provider has medical fidelity to prevent such harm, on this caliber, treatment is very, very invasive, and the options such as surgery, chemo, radiation, they all take a very severe toll on the patient's life, and it can cause physical pain as well. So, by respecting the patient's refusal for treatment, we are preventing any significant psychological and emotional harm. And in this case, the patient may actually benefit more from that spiritual comfort rather than medical intervention. So, if the patient, after receiving proper education and has a clear understanding of treatment options and what the prognosis looks like, and she still believes that she will benefit more from a faith healer, then coercion into treatment would ultimately cause more harm than good. And this is supported by an article that reviewed patient sentiments towards coercive care, which found that involuntary treatment and then showed dismissal of the patient's perspectives, led to them feeling oppressed, humiliated, and they also had lots of distrust. This overall can undermine the patient's trust in healthcare and further alienate the patient from seeking more healthcare in the future, which will cause even more harm to the patient's well-being.
A critical reason to honor the patient's decision to refuse treatment is the ethical principle of respect for cultural and religious beliefs. Healthcare providers have a responsibility to respect and accommodate the diverse culture and religious beliefs of other patients. The patient's decision to seek treatment from a faith healer is based on her religious conviction, which are crucial for her self-identity and well-being. Therefore, forcing her to undergo medical treatment against her beliefs would violate her autonomy and her religious fidelity by disregarding her right to live according to her values. Respecting her decision demonstrates cultural competence and fosters trust in the patient-provider relationship. It ensures her emotional and spiritual well-being are prioritized, allowing her to maintain her dignity and agency in her care. While the provider may not agree with her decision, respecting her faith creates a foundation of trust and openness in the patient-provider relationship. This approach establishes a sense of support that allows the patient to return to the provider if they decide to resume with professional care later on.
Some people say that the provider should consider the patient's parental responsibility when deciding to honor the patient's wishes. It must be acknowledged that honoring the refusal of treatment can impair the patient's ability to care for her children, thus doing harm to the patient's children if conditions worsen. Following the ethical principle of beneficence, the provider has the moral obligation to promote the well-being of others by bringing positive good and removing harm when present. While the provider should consider beneficence regarding the children, the provider's immediate obligation is to their patient, which is the mother. Overriding the patient's wishes to refuse surgery and treatment is harmful to the patient, and convincing the patient to accept treatment is coercion, which imposes on the patient's right to autonomy and negates the informed consent obtained. Her children should be kept in mind when discussing the risks, benefits, and outcomes. However, ultimately, it's the patient's decision and the provider's duty to support the patient through their decision.
So, in conclusion of our argument, patient autonomy is a fundamental ethical principle that should be respected and honored in healthcare, if possible. However, when a decision such as this case has irreversible consequences for the patient's health and well-being, it's appropriate for the healthcare providers to intervene in an effort to save the patient's life. In this case, by respecting the patient's decision, we would be supporting a treatment plan that would most likely lead to the further progression of the disease, a worsened quality of life, and premature death. Furthermore, the patient has a child who is dependent on her, and the refusal of treatment would significantly impact her child's well-being as well. While the patient's autonomy is in question, both non-maleficence and beneficence are both strongly being upheld. As healthcare providers, we have a duty to practice in the best interest of the patient, do no harm, and the most ethical decision would therefore be to intervene, provide treatment, and preserve the patient's health. By accepting medical treatment alongside practicing her faith, this does not mean that the patient's beliefs are in jeopardy, but it rather enables her faith and medical evidence to complement one another. Our intervention would grant the patient the best opportunity to live a full life, practice her faith, and care for her child.
In summary, when considering the facts of this case, we believe it is not only ethical but imperative to honor the mother's decision to refuse breast cancer treatment and surgery. Although this decision would be against medical recommendation, this patient and all patients have the right to make informed decisions about their medical care. Procedures such as informed consent, which are also part of the provider's responsibility, act as safeguards to ensure the patient indeed has the capacity to make these types of decisions and ensures full understanding and knowledge of the consequences of the care they are foregoing. Therefore, overriding this mother's choice would be an act of coercion and a violation of her right to autonomy, which is upheld by the Due Process Clause of the United States Constitution. It is also the provider's responsibility to respect and accommodate the diverse cultural and religious values of all their patients, as this attributes to their self-identity and well-being. Forcing treatment would not uphold beneficence and non-maleficence, as it would cause greater psychological harm to her, which is just as valuable as her physical health. While it is acknowledged that she has younger children, the provider's duty remains to the immediate patient, the mother, and upholding her right to self-determination. Although consideration of the wishes and circumstances of this patient's family and close loved ones would be best addressed during informed consent, as risks, benefits, and outcomes of refusing this care. In conclusion, although providers may not always agree or fully understand their patients' choices even after educating them, it is still the provider's oath to acknowledge, support, and uphold their autonomy. Thank you.